This is our Rifton machine. It helps with gait training, transfer training, offloading the lower extremities with any functional mobility. The first thing you want to know is make sure that the battery is on. So you would look for this green indicator light. Sometimes you'll find that we've opened this up just to save on the battery life. But to turn it back on, you just push that close and look for that green indicator light. Depending on whether they're sitting or standing already, you can lower or raise this piece here. Setup for the patient is waist level. There is a seat belt that goes around the back that you would like to make sure you cinch as tightly as you can and is comfortable for the patient. Now for some patients, this is all they need. Just that security of having something around them so that they feel comfortable walking. Now you as the therapist, aide, student, you would be guiding from the front. So oftentimes, if there's a patient that's already in the Rifton, you can help guide their path by pulling the machine. One thing to keep in mind is that if it is a larger patient, or say you're pulling up to a wheelchair, you want to make sure that you're opening the legs here, so that we're widening that base of support to provide a little bit more stability. So that's what this particular lever does. There are different attachments that you can use while utilizing the Rifton. One being a heavy-duty supportive strap in which you can hook onto any of these colors depending on the patient's size or how much support you'd like to give them. We do have different sizes of these straps, so you would want to make sure that you're choosing the correct size for the particular patient. Once again, make sure you're strapping them in tightly or enough to give them the adequate support. So if for some reason the patient's knees buckle on you, or the patient gets really tired and all of a sudden needs to stop and cannot support themselves at all, then at least the straps will help carry them as a last-ditch effort to make sure that they're safe. So it acts kind of like a sling. It's definitely a lot easier if you have a second person to help, especially if you're not familiar with how to use the Rifton.